Hello, welcome to the PowerPoint presentation on dental photography, which deals with extraoral imaging. This is the last in the modules, if you're my student, for the spring semester. Yay! Let's look at some indications for dental photography. One could be patient identification, another would be diagnosis and treatment planning, and another is pre- and post-operative records. Here's an example of a dental chart, and you can see in the lower right corner that we have a photograph of a patient. I think this might be a photograph that the patient took because of the background. Anyway, we can take these in our office and actually upload them to the dental software, to a dental chart. And this could be helpful if maybe it's a patient you haven't seen in a while, so it'll refresh your memory as to who that patient is. It could also be very helpful in any legal situations that an office or a patient might encounter. Also, photographs are very helpful in diagnosis and treatment planning. This is a typical series of photographs for orthodontic treatment. We usually take a headshot of the patient in a profile, or a front view non-smiling, or a front view smiling. And that's because orthodontic treatment definitely changes the aesthetics of the patient's face. And you can have an existing prior to treatment or before treatment, and then during treatment, how the movement of the teeth and the dental arches are affecting, how that is affecting the patient's facial features. Then we also have photographs taken of the dental arch from an occlusal perspective. And you see we have a maxillary and a mandibular. We have a smiling photograph, just kind of when the patient laughs, kind of an open smile there. And then we have the anterior occlusion as well as the posterior occlusion. So again, very typical of our photographs for orthodontics, but they could also take photographs for prosthodontic treatment, for dental reconstruction, or as we'll see in this next slide, for cosmetic dentistry. So we have a pre-photograph and a post-operative photograph that can be used as very valuable records in a patient's file. So you can see here that we have the existing condition for the patient and then a beautiful aesthetic result for this patient after treatment. Another purpose of pre- and post-operative records could be marketing for the dental practice. So some offices may even have a photo series in their office in a book for patients to actually see what kind of dentistry is being performed, what kind of cosmetic dentistry that is performed in your office, or maybe it's placed on a brochure in promoting the office, so that could be used for marketing. Next, let's look at the armamentarium and the technique. So first of all, we have a camera. Now this particular camera is a DSLR camera, which stands for Digital Single Lens Reflex Camera. And that really deals with the inner workings of the camera, how it acquires an image. And these cameras are very light. So if you're working by yourself in obtaining these images, you can actually handle and operate this camera with one hand. There's also some special lenses for dental photography as well as lighting with this particular camera. Another part of the armamentarium is a series of mirrors, and you may only use one mirror here. So these are mirrors that are used intraorally, and you're actually focusing on the mirror for some of the images, as in this dental arch image. This is the maxillary arch from an occlusal perspective. So you're actually placing the mirror and then taking a picture in the mirror for this particular view. It would be a little difficult to recline the patient so far and get our head in there with the camera in order to get this view. So the mirrors using indirect vision are very helpful. Then we have some retractors. Now this retractor here is one that can be just placed in the patient's mouth to retract the lips and the cheeks, and it's pretty much set. Then we have this metal retractor that the patient would hold, or if you're taking the photos, you could hold it, or maybe you have an assistant. That is quite helpful if you have another person to hold the retractor. But the most popular are these plastic retractors, and you can see them being used in this photograph to retract the cheeks and the lips. And the advantage of using these types of retractors versus the one that just sits in the mouth is that if you need a little more retraction to get maybe a better view, then you can gently pull on the retractor with the little handle. And then of course we need a computer to upload these photographs. Usually if you have, of course, dental software, there is an imaging section on your computer where you can upload the photographs. Remember that we still are going to practice infection control protocols, that you don't want to handle the patient's mouth and then touch the camera, because you cannot sterilize this camera, nor can you really disinfect it properly. So when you look at the technique in the video, you can see that either the patient's going to assist you, or when you get really good, you can handle the camera with one hand and then direct the patient with the retractors with the other hand. The mirrors and the retractors should be rinsed to remove any saliva, dried thoroughly, and then packaged for sterilization, so they can be placed in an autoclave. Now for the technique, there are many really good YouTube videos, and my recommendation, it's just a video I've used for a few years, is by Dr. Ashley Mark. He has a great website, All Things Dentistry, and his video, Dental Photography, the Basics, is a really good video. So that's my recommendation, but like I said, there are really lots of good videos on YouTube. Before you click on this link, and if you're my student and the link isn't working really well here, go back to your Blackboard account and you will see a link there for this video. But before you do that, let's finish out this PowerPoint presentation and then you can go to the video. Next we have an intraoral camera. Now the intraoral camera, you can see quite different equipment here, very slender camera, and it is connected to a computer, usually into the dental software. And the advantage of using an intraoral camera is that it takes the image, such as one tooth, and magnifies it 500 times. So when the doctor is examining a patient's tooth and they say, you need a new filling in this upper right molar, usually patients just say, okay. With an intraoral camera, we can actually show the patient, you can see where the old amalgam is breaking down, or where there might be recurrent decay or fractures in the tooth. So you can also see that we can get an occlusal image, but not quite as good as with the camera in dental photography. An intraoral camera can, however, in some instances take extraoral images by holding the camera just outside of the mouth so we can get a smile image there. Again, these intraoral cameras are very helpful for patient education and patient approval of treatment. So I thank you, and if you're for listening to my presentation. If you're a student of mine, we're going to be actually taking photographs on your classmate in the spring semester, and I look forward to working with you there. Also, make sure you go and look at the video by Dr. Ashley Mark, coming back here, for dental photography, the basics. Thanks. Bye-bye.